Today we're talking about 5 proven strategies to reduce your risk of requiring a foot amputation for those with burning feet caused by polyneuropathy. That is, numbness and associated peripheral arterial disease put people at risk of developing unrecognized foot injury, ulceration, and if this is left unnoticed, you can go on to have infections of the soft tissue and eventually infections of the bone. And somewhere around 150,000 people per year are getting foot amputations related to some kind of a neuropathy. My name is Dr. Kaiser from Dr. Neuro Matters. We are dedicated to all things neuro. If you have a particular topic in mind you'd like to hear about, please just let me know in the comments below. So let's jump into those preventative strategies that help keep you in the clear. Number 5, make sure you have good nail maintenance. So cut your nails on a regular basis, and it's suggested to cut your nails straight across rather than following the curvature of the nail. And the reason this is important is if you follow the curvature of the nail, you're more at risk of developing ingrown toenail, and that's problematic. If you have any sharp edges to your nails, make sure you use an emery board to file those down. Number 4, make sure you wash your feet on a daily basis, and we're looking for warm and soapy water, making sure you get the soles of your feet and in between the toes. When you're done washing your feet, make sure you dry them thoroughly, again getting the soles of the feet and gently in between the toes. And after you're done drying your feet, I suggest applying a lotion such as Gold Bond Diabetes Lotion, or similarly some kind of a foot powder that you put between the toes to prevent growth of fungus. Now, before we get to number 3, if you're new to this channel, I hope you consider subscribe this video to sign up for future content. And again, if you had comments or suggestions about additional topics, please just let me know below. But number 3, make sure you get some good quality shoes, and shoes should be worn at all times, even if you're around your house. And I would suggest shoes that are sponsored, certified by the APMA. So look for that kind of a label, that marking wherever you buy, even if that's online. Ideally, you should be getting your shoes, or I think you should be getting your shoes in person, because that way they can make sure your shoes are fitting you appropriately and making sure there's no unusual pressure points. Some of you may require custom fit orthotic shoes, and I'd suggest work with a podiatrist or your primary care physician to figure out how to do that. Number 2, make sure you get high quality socks, and I would suggest socks that have some kind of a blend of materials, merino wool, synthetic materials that are known to wick away moisture from the surface of the skin, that reduces risk of fungal infections. Avoid socks that have some kind of a seam, tight-fitting socks that have elastic bands in them, which pose increased risk of pressure-related injuries. Always wear your socks with your APMA shoes, and it's good to get socks that are white in color, just because if there's some kind of blood discharge, you can see that when you take the socks off. Number 1, this is probably the most important of these points, making sure you're checking your feet on a daily basis. You're checking the soles of your feet in between your toes, and you're looking for cracking, ulceration, redness, warmth, pain, anything that's out of the ordinary. And if you can't inspect the bottom of your feet just by looking, you can do things like get mirrors, or even with our technology today, maybe put an iPad on the ground, iPad or your phone, and look at the surface of your foot that way. If these are not practical for you, or you don't have those devices, maybe get a friend or a family member to help you do that. And if you don't have that, then get yourself checked out at your primary care doctor's office. For everybody, even if you're able to inspect your feet on a daily basis, it's good to check in with your primary care doctor or podiatrist on an annual basis. If you found something concerning on your self-examination, it's good to get it checked out with your primary care physician, an endocrinologist, a podiatrist, somebody that can direct you to get additional care. Now, if you found this information helpful, I hope you'd sincerely consider staying around, watching some additional videos. And this is Dr. Kaiser, where Neuro Matters.